about 20,000 women die every year in our country as a result of unsafe abortions. The word emergency is very, very important. It is not a chocolate that you can take every day.
There's a lot of young women today actually either Google it or ask to all of those AI sources about what to do when they've had an unprotected intercourse. So, and there are a lot of information that's available online. So as a doctor, how would you debunk myths around this?
I love patients who Google it because they are more confused. Then they would come to us. In fact, I have a mug on my table that says, "Don't confuse Google with my MD degree. I'm 33 years old." Now, what is the worst thing that an IPill or a morning after pill can do? She gets pregnant. Please go to a medical professional and not a quack.
Welcome back to the Pluro Podcast, where we have honest and open conversations around fertility and reproductive health. Today, we're going to talk about a topic around emergency contraception, which lies at the intersection of science and stigma. Today, we have Dr. Atul with us, who is going to bust all the myths and fears around this topic. Dr. Atul is the head of Progeny, Pluro Fertility and IVF, with about 33 years of experience as a senior gynecologist and IVF specialist. So, sir, let's start right at the beginning. Whenever a couple reaches out for emergency contraception, what does that pill do?
So basically, remember, in a menstrual cycle, there are two types of hormones. In the first 15 days, we have estrogen. The second 15 days, we have progesterone. If the progesterone levels are very high, even in IVF, for example, we have a marker in IVF where before we do an embryo transfer, we do the progesterone levels. If that progesterone level of the patient is more than 1.5, we don't do a transfer. So that's exactly what we use as an advantage when we want to give the pill, the morning after pill. So we give them a very high dose of progesterone, for example, the IPill. So conception doesn't take place. But remember, the best time to take the IPill is within 24 hours, max up to 72 hours. There are other methods also, but this is the most common used emergency contraception pill. Now we have another drug called azulipristal, which works up to slightly more time for about 5 days. 30 milligrams of that azulipristal again does the same action, does not allow a fertilized egg to go and implant on the endometrium.
All right. So honestly, sir, there's a lot of confusion between emergency contraception and abortion. So if you can just help us understand what's the difference between them.
So remember, the word emergency is very, very important. It is not a chocolate that you can take every day. It has to be used judiciously. Let me go one step behind for our young adults. Contraception is to prevent pregnancy, but the using a barrier contraception is to prevent infection. Infection in terms of STI, that is sexually transmitted disease, infections in terms of HIV, etc. So when a patient comes to us for counseling, we tell them two things. One is to prevent pregnancy, one is to prevent infection. If it is to prevent infection, they have to use a condom or a barrier contraception. So the myth is an emergency contraception pill is going to prevent a pregnancy, whereas an abortion is done after the woman is pregnant, after a urine pregnancy test is positive, after a sonography has diagnosed that there is a small pregnancy or a small sac seen in the uterus.
Understood. So, sir, the morning after pill usually has this reputation of being quite dangerous in terms of messing up with the hormones in the long term, if it's taken repeatedly. So, how do we understand that?
So, like I said, for Ganpati, for Diwali, for marriage, for any social function, women do come to us and say that मला पाडी नाही आली पाहिजे, ह्या तारखेला माझं लग्न आहे, ये तारीख तक मुझे पीरियड नहीं आना चाहिए, या ये तारीख को हमारे घर में पूजा है, मुझे पीरियड नहीं आना चाहिए, मुझे हनीमून पे जाना है, मुझे पीरियड नहीं आना चाहिए. So we give them medicine 4 days before their expected period till the date she does not want to get period, up to 14 days. So we give them a small dose. Whereas if you take the morning after pill, you're taking a very, very high dose. Let me give you a real example. I had this young girl who came to me and said, I have not got period for 3 months. So I gave her the usual pill like we give during a social function, twice a day for 5 days. And she did not get her period. She came to me 10 days later, said, you said in 7 days after I stop the pill, I will get my periods. I have not got periods. So I said, okay, let's do an ultrasound. The ultrasound looked all right. And again, I gave her another dose. She still did not get a period. So then I made her sit. I asked, I'm a male gynecologist. I have women in my room all the time assisting me. So I made her sit. And I asked her, बच्चा कुछ तो ऐसा है जो तूने मुझे नहीं बताया है. Because इतने सालों की मेरी प्रैक्टिस में ऐसा कभी नहीं हुआ है कि मैंने दवाई दिया और पीरियड नहीं आया. Is there anything that you want to tell me? She said, नहीं ऐसा तो कुछ नहीं है, लेकिन एक ही बात है कि डॉक्टर मैंने पिछले हफ्ते 5 IPill खाई थी. So now that's the most important thing. She said she never told me she took such a high dose of hormones. Like she's had a picture of the hormone. I'm giving her a 30 ml dose. So I said, बच्चा अभी छोड़ दे, तुझे 3 महीने period नहीं आएगा. So that is the most important myth that patients have. That's like I said, it's not a chocolate. Very, very good drug to be used in an emergency, but not repetitively.
Yeah, that actually.
There are better methods.
Yeah.
Another example of a young girl, less than 20, not married, active, strict Jains, will not take hormones. Already 5 days over, did not want to reveal the fact to her family. She came to me alone. So I said, मैं दवाई लूँगी तो पकड़ी जाऊँगी. She was a Muslim. दवाई लूँगी तो पकड़ी जाऊँगी. घर में से मेरे वॉलेट में चेक करेंगे. I can't take any pill. मैं क्या करूँ? So we offered her that we put a copper T device. Put a IUCD inside the uterus or a copper T. Even it is 6 days after the act of intercourse or the unprotected intercourse, the copper T will not allow implantation. That will happen about 12 days later. So we inserted the copper T. She got her periods. 3rd day of cycle, I removed the copper T. That's another very, very valuable method of emergency contraception. So again, patient to patient, it has to be taken care of.
So there is no exact time duration.
For hormonal pills, it is.
Yeah.
For the copper T, you have more leverage.
No, for the implantation to happen.
So in a patient, see, again, it depends upon the patient's ovulation. If she is getting a 30-day period, which means her ovulation is taking place around day 14, day 15. If she's getting a 25-day period, I tell my patients, your periods will come 15 days after your egg ruptures. If your egg ruptures on the 10th day, you'll get a 25-day cycle. Egg ruptures on the 15th day, you'll get a 30-day cycle. If your egg ruptures on the 30th day, you get a 45-day cycle. So the second half of the period is fixed, 45 days. First half is not fixed. So history taking is important.
Right. That actually brings me to my next question, sir, because a lot of young women today actually either Google it or ask to all of those AI sources about what to do when they've had an unprotected intercourse. So, and there are a lot of information that's available online. So as a doctor, how would you like debunk myths around this?
I love patients who Google it because they are more confused and then they would come to us. In fact, I have a mug on my table that says, don't confuse Google with my MD degree. I'm 33 years old. So when they are confused, they come to us very easily or they will make a mistake.
Yes.
Now what is the worst thing that an IPill or a morning after pill can do? She gets pregnant. Now we have medical methods of abortion. Up to about 9.3 weeks, we can give them the medical methods. So I love confused patients.
No, that's actually true. Okay, so there's a window of time that actually matters here, like you said. But the sooner you take it, the better it works. I'm talking about the morning after pill. But a lot of people either don't ask because of shame or fear. What actually happens to the effectiveness if the hours pass, say after 72 hours, if it's taken?
Then our chance of pregnancy becomes higher. So a lot of patients go to the chemist and ask. Even today, majority of our patients go to the chemist and get their pills, whether it's a headache or a morning after pill or an abortion pill. Even today, unfortunately, it's supposed to be a prescribed medicine, but in our country, it is an OTC product. So it will fail. That's the only thing. And it causes a complete haywire of their menstrual cycle. Because I told you, they take an extremely high dose when only a little bit of the hormone is required.
Right. So, sir, like you mentioned, in our country, emergency contraception is an OTC drug, fortunately or unfortunately. So, what is the real effectiveness on the clinical cost that comes if it's taken haywire?
That's a very interesting question. Now, I was the chair of the MTP committee of the Indian organization, that is Foxy. Jaideep was and a lot of us were chairmen, and one thing we've said very often, the old timers, the full timers, they feel that नहीं ये दवाई OTC नहीं मिलनी चाहिए. But we argue it is better that woman goes to the counter and picks up that pill from a chemist rather she goes to a quack and gets a stick inserted or gets non-medical harmful alternatives to taking the pill. And what is the worst thing that can happen? They will come to us with severe bleeding. That is the worst thing that can happen. Or very rarely, and a major argument, I happen to be in the Nirman Bhavan in Delhi, where one of the bureaucrats said, उसकी ट्यूब फट गई. I said, अगर वो प्रेग्नेंट होती विदाउट दैट और उसको प्रॉब्लम होता तो फिर भी ट्यूब फटती. तो एटलीस्ट वो ट्यूब फटेगी या पेन होगा या ब्लीडिंग होगा या चक्कर आएगा तो वो हॉस्पिटल में आएगी, वो क्वैक के पास नहीं जाएगी.
True.
It does not endanger her life.
Yeah.
At least remember one thing, if a woman or any human being has a problem, they will not go to a quack.
Agreed. Yeah.
So they will come to a medical professional, and that is fine.
Right. So, sir, if say a condom breaks or a pill is missed, what are the realistic actions a couple can take?
Actually, nothing. Pray. Either they take the pill. And remember one thing, if you have 10 honeymoon couples trying for a pregnancy, they all get married on the same day and they go on their honeymoon. What is the chance of them? How many of them will get pregnant in the first cycle? 20%. Everybody doesn't get pregnant in the first attempt. So that 20% risk is all right. As long as they are educated enough. And I think that's where our medical professionals' responsibility comes. Podcasts like this will help that please go to a medical professional and not a quack.
Right. So, in your experience, what is the emotional state that a woman comes to you in or a couple comes to you in after, they've panicked so much regarding the emergency contraception, and how would you address them?
The first thing I try to do is to calm them. I said, it's all right. Hota hai.
Yeah.
Let's learn from this and not make the same mistake again and again. That is the most important thing. There are various methods. I can tell you, I have about 46 Muslim patients where contraception is not allowed. They come and take an injection from me, which is to be taken only once in 3 months for contraception. They quietly come, take the injection, and they go away, because if they find a copper-T in that patient, the in-laws or the husband will fire her. If they find a 21-day OC pill in their purse, they will get caught. But with an injection, nothing happens. For so many years, patients have been coming to us quietly, making us their confidant, and taking this injection once in 90 days, and nobody comes to know that why she's not conceiving. Because she already has 3 or 4 children. As a result of religious problems, they are not allowed any form of contraception. Family planning operation is not allowed. Catholics are not allowed abortion. That's what adds to the maternal mortality in our country. And the minute the pill came in 2003, when we were a part of the group which made the regulations for the pill in 2003, our maternal mortality, that is the death rate of pregnant women, dropped from 12% to 8%, and not because of doctors, it is because of the pill, and we give credit to that.
So, adding to that, you mentioned about in-laws and the partner not being very affirmative to the women, but I've seen that contraception is usually associated with women, but pregnancy is a two-way thing, right? It's between a male and a female. So what role does a husband or a partner need to play here?
I think point number 1, I don't discuss contraception unless the husband is not there. We have standing instructions to the patient that at the end of 30 days of your delivery, you come to us with your partner or your husband. This is about a patient who has just delivered. And I tell the husband that she is going to bear the pregnancy for 9 months, she is going to breastfeed. The least you can do is use condoms, at least till she's comfortable using the next mode of contraception. We write 1, 2, 3, 4, condoms, tablet, intrauterine device, and the injection. And I tell the patient in front of the husband, if your husband is a good boy, he will help you with a barrier contraception or a condom. Otherwise, I'm sorry, but you'll have to use these things. And I also tell them husbands are idiots. They have a 5-minute role in the entire pregnancy. If they don't listen to you, it is up to you to look after your body.
Oh, that's absolutely true. And being a woman, I kind of understand and relate to this.
And I'm always on the woman's side.
Thank you so much. So, sir, what typically happens is that some people, like you mentioned, take this emergency pill more than once and often regularly because they don't know what else then they can do. So, is there a better way to kind of avoid pregnancy while doing unprotected intercourse?
सो जब पेशेंट मेरे पास डिलीवर होके आती है तो मैं हमेशा पेशेंट को बोलता हूँ, सबसे पहले जब आप डिलीवरी के बाद 1 महीने के बाद फॉलोअप के लिए आते हो, आप हस्बैंड के साथ आइए और तब हस्बैंड के सामने मैं पेशेंट को बताता हूँ, दीज आर योर, ये आपके 4 ऑप्शंस हैं: कॉन्डम्स, टैबलेट्स, इंजेक्शंस, कॉपर्टी या दूसरा डिवाइस जिसको मेरे ना बोलते हैं। अगर आपका हस्बैंड अच्छा आदमी है तो वो कॉन्डम यूज़ करेगा, वो कम से कम उतना तो कर ही सकता है जब आपने बच्चा 9 महीना झेला है, आपने डिलीवरी या सिजेरियन करवाया है और आपको अभी ब्रेस्ट फीड करना है। हस्बैंड का काम सिर्फ 5 मिनट का होता है, तो एटलीस्ट इतना तो वो आपके लिए कर ही सकता है। और आपका हस्बैंड अगर अच्छा आदमी है तो शायद ये यूज़ करेगा। मैं हमेशा लेडी के साथ हूँ, वुमन के साथ हूँ, मदर के साथ हूँ।
So thank you so much, sir, for saying that. My next question to you will be: you've been on the medical advisory panel of the Family Planning Association of India, and you mentioned in 2003 this bill was launched. So from a policy and access standpoint, are we doing enough to make emergency pill not just accessible but also understood?
वी आर डूइंग आवर बेस्ट। हम कोशिश तो बहुत कर रहे हैं। इनफैक्ट हर मीटिंग में, इनफैक्ट अ वेरी डियर फ्रेंड ऑफ माइन, द चेयर ऑफ द फैमिली प्लानिंग एसोसिएशन, डॉक्टर नोजा शहरियार, आई हैव सजेस्टेड दैट वी शुड डू पॉडकास्ट्स, वी शुड डू questions on midday, like what Mahendra Vatsa's column used to come on sex. We should do these regular weekly or monthly questionnaires, 3 or 4 questions in various languages where patients can kind of read those, because I'm told that Mahendra Vatsa column was very, very widely popularized.
Yeah.
Everything that we can do between IPL matches, a podcast like this for about 30 seconds, between news channels, between popular movies like a Durandar movie, you give वो एक छोटा सा kind of 30 seconds का episode on emergency contraception या property या 21-day pills के बारे में. I think we should do much more that we are doing, because today, even today, our maternal mortality rate is 8%. About 20,000 women die every year in our country as a result of unsafe abortions.
That's actually a scary statistic
Absolutely.
to look at. No, so I feel like if people and essentially women know how to deal with this, it's just not safe for them only, but also will contribute to the rising population of our country as well. Like if you've taken all of this into
Absolutely.
consideration. So my last question to you will be that if there's a young woman somewhere listening to this and she is undergoing this entire process, what advice would you want to give to her?
Please be safe. Please go to a medical professional. And remember, there are 2 aspects of contraception. One is to save yourself from infection, and second is unplanned pregnancy.
Dr. Atul, this has been such an important conversation because at the end of the day, it is just not about a pill, but also the information that surrounds it. And to everyone listening, thank you for bringing clarity and confidence to this topic. And stay tuned to the Pluro Podcast.